My name is Shawnee Hersey. I'm a student nurse at Mount Hood Community College, and I'm here to tell you a little bit about breastfeeding. I'd like to talk about some of the advantages and give you some tips and tricks to set yourself up for success with your newborn baby. First, I think one of the biggest advantages is just that you know you're giving your baby the exact perfect nutrition that he or she needs. In the first couple of days, you're going to have colostrum. It's going to be a thicker, yellowish colored milk that is going to be high in antibodies, high in protein that the baby needs, and it also serves as a natural laxative just to get your baby's own system up and running. Your milk's going to then mature over the next few days, reaching its full maturity by about day 10 or so. And even then, the milk that's stored in between feedings is going to be higher in water content. So when you first start nursing, it's going to quench your baby's thirst right away. And then as you continue with the feeding session, the milk's going to get a little thicker and higher in the protein, fats, and calories that the baby needs. Other advantages for the baby: babies that breastfeed over formula feed have fewer ear infections, fewer respiratory infections. They have a decreased risk of obesity in childhood as well as adulthood. They are less likely to develop other autoimmune system diseases such as type 1 diabetes, multiple sclerosis, or rheumatoid arthritis. They have fewer allergies than other children, and they also have fewer dental caries most of the time. There are benefits to the mother as well. Initially, right after birth, breastfeeding releases oxytocin, which is going to contract the uterus. It's going to help prevent hemorrhaging, and it's going to help just get you back to your pre-pregnancy condition faster. There's also prolactin, a hormone that is responsible for milk production that has been shown to have a calming effect on mothers. So anytime you can feel more at ease and relaxed and calm while you're at home with your newborn, the better off you are. And also, it's just good for the environment. There's no processing involved. There's no transportation involved. You don't have to have rubber nipples. You don't have to put it into plastic bottles. It's just ready to go. It's convenient. It's good for everybody involved. I'm gonna take my baby here. We're gonna go over when you get started breastfeeding. Key is to make you and the baby as comfortable as possible. So you'll want to find a comfortable place to sit. I've got a glider here. I've got my water ready to drink because you're gonna want to keep yourself hydrated during your feeding session. You can get pillows that have these little cutouts to help support the baby, or you can just go ahead and use a pillow from the bed or nothing at all. It's just a matter of finding out what's going to work best for you and your baby, what's going to be comfortable. There are a couple of different holds. The easiest I found was just the cross cradle hold, supporting the baby's head in your hand and the rest of its body across your arm. You're going to want to be abdomen to abdomen and line the nipple up with the baby's nose and mouth. This gives you the best control, and as the baby starts to open to feed, you can bring the baby's head to the breast rather than the breast to the baby. Another hold that some mothers find more comfortable, particularly if there was a cesarean delivery, is the football hold, cradling the baby again in your hand. You can use the arm of the chair as well as your arm and your side to support the baby's body. And again, you're going to want to have hands and arms out of the way. Line the nose and the mouth up with the nipple and bring the baby to the nipple rather than your breast to the baby. Some people just like a regular cradle hold, but I found that more difficult for me. And some mothers breastfeed in bed, so you can just make yourself as comfortable. It's just a matter of trial and error and finding out what's going to work best for you and your newborn. I had hoped to have an actual baby and mother here to demonstrate, but since I don't, we're going to come over and get the next best thing, YouTube and internet videos, so I can show you some of the key aspects. Pardon me. First, I have a video showing a mother and her newborn working at latching on First, you're going to see that she's getting in position. She's got her pillows and comfortable. She's going to stroke the baby's upper lip with her nipple, and then as the baby opens wide to start to nurse, she's going to bring the baby's head to her breast. It doesn't always work the first time. Here the baby didn't want to latch on, so she's trying again stroking the upper lip. As the baby opens wide, baby comes into the breast, and you'll start to see some sucking in the cheeks and know that the baby is latched on. There shouldn't be a lot of pain with this. Initially there may be some discomfort that will go away over time, but pain is a sign that the baby hasn't latched on correctly. Excuse me. I have another video that just shows the difference in milk that you're going to get if the baby is latched on shallow versus a nice deep latch. Get this full video. You can see, let's start this over if I can. So you can see the whole thing. With just a shallow, just on the nipple, you're not getting very much milk. But if the baby has a deeper latch, then the milk flows freely and they're able to drink and get a full mouthful. And the last video I have is from YouTube. And this just shows what you're looking for to know if your baby is eating well. So you can see in this video, I'll open it up. You can see both babies' lips are flanged outward, especially the bottom lip. You can see the chin drop as the baby sucks in, and then it comes back up and you can see the baby swallowing. So if you're getting this suck, pause kind of thing going on with the chin, then you know that the baby's going to be getting adequate nutrition and you're both going to be happy. So a couple of organizations that will help with information. I have Breastfeeding Inc. that supplied my videos. This is the website for them. They have a lot of good information, resources, other video clips that you can watch to get more comfortable. And the La Leche League International is another organization that encourages breastfeeding and has lots of good information. There's actually a Gresham chapter that has get-togethers every first and third Tuesday of the month. And it's open to any breastfeeding mothers or pregnant women that are interested in breastfeeding, just to get information and help. I want to thank you for watching my video, and I hope you found it informative.